Welcome to the deep dive. Today we're cutting through some of the conventional wisdom, really, to reveal something pretty groundbreaking,
Hmm.
that your most persistent health challenges, maybe difficulty focusing or even chronic pain, might actually be deeply rooted not just in your genes, but in the earliest experiences of your life.
Yeah,
We're about to unpack a really revolutionary perspective, I think, that could fundamentally reshape how we understand healing and well-being.
that's absolutely right. And our mission really in this deep dive is to explore that profound connection. It's often overlooked, isn't it, between early childhood experiences, maybe moments of trauma, and, well, a surprising array of adult health conditions. We're talking about things like ADHD, addiction, even getting into the complex world of autoimmune diseases.
And the aim here is really to challenge that prevailing medical view, the one that often focuses primarily, maybe even solely on genetics as the explanation.
Yeah. Exactly. Instead, we want to emphasize how environmental factors and, crucially, the emotional conditions during our development fundamentally shape our brain function and, by extension, our overall health.
Our aim here is to provide you, the listener, with clarity, perhaps some truly surprising insights, and honestly, an incredibly empowering message about healing.
Mm-hmm.
It's really about understanding why certain challenges show up, not seeing them as some kind of personal flaw or, just bad luck in the genetic lottery.
But maybe as an ingenious adaptation, a response to circumstances.
Exactly. So let's start to unpack this. Okay, so when we talk about childhood conditions, what
And-
exactly are we referring to? Because I think for most people that phrase brings up a pretty narrow image, maybe,
Right.
severe overt abuse or neglect.
Right.
But you're suggesting the concept is much broader, more comprehensive. What's the bigger picture we need to grasp here?
Yeah, that's a really vital starting point because the idea of childhood conditions, it really is far more encompassing than what's typically understood. It's not solely about what we might conventionally label as trauma in that very extreme sense, although of course that's included.
Sure.
It's just much more multi-layered, it's nuanced.
So if we're expanding the definition, what are these crucial layers then? What are we talking about?
Well, I see it as having two fundamental aspects, and they're really intricately intertwined. First, you've got the physical conditions.
Right.
These are the absolute basics for any developing human being, right?
Yeah.
Adequate nutrition, a stable and safe home environment, sufficient physical comfort. Are they warm? Are they fed? Do they feel physically protected from harm?
Okay, yeah. The tangible stuff.
Yeah.
The things we can often see or measure.
Precisely. Those are foundational elements of safety, of security. But equally, and I'd argue maybe even more crucial sometimes, are the emotional conditions. Now, these dig into a child's really deep-seated sense of being accepted for who they are, feeling truly seen, deeply understood, not just for what they do or how they behave.
That feels much harder to pin down, though.
It is, and these conditions are profoundly shaped by the emotional states of the parents themselves. So, for example, are the primary caregivers experiencing chronic stress, maybe because of their own unaddressed traumas from their past?
Right.
Or are they maybe burdened by significant economic struggles that just impact their capacity to be emotionally present and attuned to the child?
So it's not just the child's direct experience, like something happening to them, but the whole emotional climate around them. That's what's shaping things.
That's exactly it. It also includes the stability of the home environment. Like, is there constant conflict? Or maybe an unsettling lack of predictability in their daily lives? Is there that sense of safety? Or is every day, a new source of anxiety for a young child?
Yeah.
And then you can even extend beyond the immediate family. Think about broader community support.
Yeah.
Is there an extended family network? Aunts, uncles, grandparents who can provide a buffer or offer some respite to parents who are just overwhelmed.
Or the opposite, perhaps. Isolation.
Or isolation, yeah. Particularly thinking about, say, a single parent struggling to make a living and raise a child without much of a support system. All of these factors, physical and emotional, they profoundly affect a child's developing personality and absolutely critically, their brain development.
Okay.
The brain, right from the earliest stages, is actively responding. It's wiring itself based on this whole tapestry of experience.
Okay, that leads us straight to a really fundamental question,
Yeah.
one that challenges so much of what we're taught, certainly in conventional medical models. Do childhood experiences directly create or cause conditions like ADHD, addiction, autoimmune issues? Because we're so often told these are primarily genetic, right? Something you're just born with, an immutable part of your biology.
Right. That's a vital question. And the answer, well, it's complex, but when you really look at the evidence, it seems pretty clear. Yes, they do, alongside certain genetic predispositions.
Ah, okay. So it's not instead of genetics, it's with genetics.
Exactly. That's the critical distinction that often gets lost in the usual medical narratives. It's not an either-or situation, it's a dynamic interplay.
Right.
Think of it like this, and this analogy seems to really help people grasp it. Genetics might load the gun, so to speak,
Mm-hmm.
but the environment pulls the trigger. You can have identical genetic blueprints, like in identical twins, but depending on those early environmental conditions, those same genes can lead to vastly different outcomes. We see
Wow.
this unequivocally in studies, both with animals and humans. For instance, you look at identical twin studies where one twin experiences significant early adversity and the other doesn't. Despite having identical genes, their health outcomes, even their brain structures, can diverge significantly later in life.
That gun and trigger analogy really does hit home. It clarifies that interplay perfectly.
Hmm?
So what's the issue then with how traditional Western medicine tends to view this?
Yeah.
Often separating mind from body and seeing conditions like ADHD as purely genetic.
Well, the problem is that traditional Western medicine often operates within a paradigm that historically has separated the mind from the body, treats them as distinct things.
Right, Descartes.
Yeah, exactly. It tends to view brain biology kind of in isolation as if it exists independently of life experience.
Mhm.
So conditions like ADHD are frequently diagnosed as purely genetic disorders, and the treatment, well, it focuses almost exclusively on managing symptoms, usually with medication.
Mhm.
But here's the kicker. If ADHD were purely genetic, why are the numbers increasing so dramatically all across the globe?
That's a really good point.
Genes just don't change in a population over a few decades or generations like that. This exponential rise, it absolutely points towards significant environmental influences. It's a clear, undeniable signal that something in our modern environment is profoundly affecting child development on a really large scale.
Yeah, that rise in diagnoses is definitely alarming. But, for listeners who might still be thinking mainly about those genetic predispositions, what's the strongest counter evidence? Or maybe another way to explain how the environment could cause such a widespread increase without some massive genetic mutation happening.
Well, think about how our understanding of the brain itself has evolved. We now know, like, unequivocally, that the brain isn't some fixed, pre-programmed machine. It is, to borrow a really powerful phrase, a social product.
The brain is a social product. That's fascinating. Provocative. How does that actually manifest during development?
What it means is that a child's brain development is fundamentally dependent on the emotional and physical conditions they live under. And this dynamic interaction, it starts even in utero.
Wow, even before birth.
Oh, yeah, and it continues throughout life. The actual circuitry, the very wiring of a child's brain, is programmed by how the environment interacts with their genes. Different environments will act differently on the very same genes, leading to different expressions. There's a whole field studying this now, epigenetics.
Right, epigenetics.
For a really concrete example, let's think about dopamine receptors. Dopamine, as we know, is a crucial brain chemical. It's vital for motivation, pleasure, and critically for this discussion, for focus and attention.
Mm.
Well, the number of dopamine receptors that actually develop in a child's brain is significantly affected by the level of stress experienced by the mother during pregnancy and, of course, after birth as well.
Okay.
There's groundbreaking research, for instance, with mice that shows if you isolate them, the number of dopamine receptors in their brains actually goes down. But if you bring them back into companionship, provide a supportive, interactive environment,
Number goes up.
the number of dopamine receptors elevates.
Yeah. So even down at the cellular neurological level, social connection and a supportive environment literally change the brain's physical structure, its actual capacity for focus and well-being. That's truly incredible.
It just illustrates the brain's astonishingly interactive nature, its adaptability throughout life. Now think about what happens when a human being, especially a developing child, experiences chronic stress, maybe feels under constant threat or endures isolation or feels perpetually invisible, uncared for.
Yeah.
Their body naturally shifts into a sustained fight or flight response. It's a survival mechanism.
Right.
But when that state becomes chronic, it directly interferes with the optimal production and regulation of vital brain chemicals, like dopamine, like cortisol, the stress hormone. Furthermore, it impacts key brain regions. Think about the hippocampus, absolutely critical for learning and memory formation. And the amygdala, the brain's sort of alarm center, involved in processing emotions, especially fear and anxiety. Chronic stress affects the function, even the structure of these areas.
So the brain isn't just reacting to stress in the moment. It's being reprogrammed or rewired by it during these crucial developmental years. Its fundamental architecture is actually adapting to a perceived threat.
Precisely. As Dr. Bruce Perry, who's a leading child trauma psychiatrist, puts it so eloquently, the brain is a historical organ.
A historical organ, I
Yeah.
like that.
It quite literally stores the impacts of life experiences. So when we talk about brain biology, we must never fall into that trap of thinking that the biology is somehow separate from life experience. It's not. It is fundamentally shaped by it.
Okay.
Now, it's absolutely crucial here to emphasize. There's no parent blaming in this. Let me be really clear on that.
Right, that's important.
Parents typically do their absolute best given their own challenges, their own circumstances, often their own unresolved traumas and limitations. The focus here is purely on recognizing the profound impact of early experiences on the child's developing brain, and then hopefully empowering parents and individuals to create different, more nurturing conditions.
Like the plant analogy you used.
Exactly. You wouldn't blame a plant for not growing if it didn't get enough sunlight, would you? You'd adjust its conditions. It's the same principle for a child's brain development and actually for a person's healing journey later in life, too.
That's such a powerful shift in understanding that our brains literally encode our life stories and adapt to them. So with that foundational insight, how environment shapes brain biology, let's apply this kind of revolutionary lens to specific conditions. Starting with ADHD, which is something so many listeners are familiar with. For so long, the common understanding, the narrative, has been it's a genetic disorder, treated primarily with medication. How does your perspective challenge that?
Well, let's just look at the common medical approach for a second.
Yep.
ADHD medications are stimulants, right?
Right. Ritalin, Adderall.
Exactly. And what do stimulants do in the brain? They elevate the level of dopamine. And as we just discussed, dopamine is essential for motivation and, critically, for sustained focus and attention. So this immediately tells us that a dysregulation or maybe an underdevelopment of the dopamine circuitry is at the core of the issue in ADHD. But here's the vital point, the one that's often overlooked in standard medical practice. This circuitry doesn't just develop in a vacuum. It develops in dynamic interaction with the environment, particularly early in life. It's not simply some preset genetic program that just unfolds regardless of external input.
So the very thing the medication targets, that dopamine circuitry, is itself fundamentally influenced by our early experiences and environment. That's huge.
That's right. And, when we see ADHD tending to run in families, it's very easy and understandable to jump to the conclusion that it must be purely genetic, that some disease gene has been passed down.
Yeah, that seems logical on the surface.
It does, but often it's not just about inherited genes for a disorder. Instead, it's because the conditions that shape the parent's development, maybe chronic stress, emotional unavailability, financial struggle, whatever it was, are frequently repeated, often unconsciously, in the children's lives.
So the environment gets passed down, in a way.
In a very real way. Now, what is often inherited is a genetic sensitivity, or maybe a particular temperament. Some children are just naturally more sensitive. They feel their environment more intensely.
Okay.
So if that environment is stressful or overwhelming or inconsistent, they are naturally more profoundly affected. Their developing brains, being maybe more porous and responsive to external stimuli, are simply more likely to adapt in ways that we then categorize and label as ADHD.
So an inherited sensitivity, not an inherited flaw or a predetermined disease, that's a massive distinction. It changes the whole narrative around ADHD, doesn't it?
It really does.
So if it's not purely genetic, how does ADHD manifest? And what are those manifestations actually adaptations to?
Okay, so imagine a sensitive child growing up in a stressful, maybe overwhelming or even chaotic environment. If they feel unable to escape that situation or unable to fight back, a natural unconscious coping response kicks in. Tuning out.
Tuning out, like zoning out.
Yeah, dissociating, mentally checking out from a situation they just can't control or resolve. This then becomes a wired-in adaptation in their developing brain. It becomes a default mode. Now, while that serves a powerful purpose for survival in childhood, it helps them cope with intolerable stress or emotional neglect or just overwhelm.
Right, it protects them in a way.
It does. But later on, it creates significant problems in environments that demand sustained focus, engagement, and consistent attention, like a classroom or a structured work setting.
So the absent-mindedness or the tuning out isn't them being difficult or lazy. It's actually a survival mechanism that got hardwired early on.
Precisely.
What are the other key traits we associate with ADHD, like impulsivity? Where does that come from?
Yeah, exactly. Then you have poor impulse regulation, this crucial brain circuitry, particularly in the prefrontal cortex. The part often described as the brain's executive control center, the bit that helps you hit the pause button before acting. Well, it just doesn't develop optimally under conditions of chronic stress. Think back to the plant analogy. For any complex organism or function to develop robustly, the conditions have to be right.
Yeah.
If a plant isn't thriving, you don't blame the plant, right?
Yeah.
You look at what's missing, maybe nutrition, sunlight, water. It's the same with a child's brain. Impulse regulation is a sophisticated developmental function. It requires a relatively calm, safe, and consistent emotional environment to mature effectively.
Okay.
So when a child's nervous system is constantly in a state of fight, flight, or freeze, the brain's resources for developing those higher level executive functions get diverted to just basic survival. And those critical neural pathways, they're just not getting the optimal environment they need to develop robustly.
And what about the hyperactivity? That's often seen, especially in boys, right?
Yeah, hyperactivity, which is indeed more commonly diagnosed in boys, is often linked to underdeveloped function in the midfrontal cortex. This region is critical for regulating the body's movements, for filtering out stimuli, and for sustaining attention. So when a parent describes their child as acting out, these behaviors, the fidgeting, the inability to sit still, are often simply the child's unconscious way of acting out their intense emotional needs and unexpressed inner dynamics. They don't yet have the language or the emotional literacy or maybe the capacity to express these internal states in a more regulated way.
Right.
And that constant movement, it can also be a way for the nervous system to try and discharge all that pent-up stress energy that it just can't process otherwise.
It feels really crucial to reiterate here. Because this topic can be so sensitive for parents. Yeah. This understanding isn't about blaming parents for their child's ADHD.
Absolutely not. And I've been accused of that, but it's the last thing I want to do. It runs completely counter to the spirit of compassion and understanding that we need here. Parents typically do their very, very best with the resources and understanding they have at the time. Yeah. But their best is often limited by their own particular challenges, their own circumstances, maybe their own unresolved traumas, or just a lack of support networks. The focus is purely on recognizing the profound impact of early experiences on the child's developing brain. And then the hope is to empower parents to maybe consider creating different conditions or seeking support for themselves and their family. If a child's brain develops in partnership with the adults around them, then changing that partnership, changing the emotional environment, can lead to significant positive change. It can even foster that neuroplasticity we talked about.
This brings us to a really common misconception, I think, about diagnosis itself.
Yeah.
What does an ADHD diagnosis actually mean? Is it truly an explanation for why these traits exist?
Yeah, this is a point where medical practice often goes a bit astray, I think, and it leads to a profound misunderstanding for patients and families. A diagnosis like ADHD, or frankly most diagnostic labels in mental health, it often just describes a set of symptoms, right? Absent-mindedness, poor impulse control, hyperactivity. But it doesn't actually explain the root cause. It doesn't explain the underlying developmental pathway that led to those symptoms appearing. It can easily create a kind of circular reasoning.
How so?
Well, why are they hyperactive? Because they have ADHD. Well, how do we know they have ADHD? Because they're hyperactive, you see.
Oh, right. It just goes in a circle. Description, not explanation.
Exactly.
Yeah.
It's a classic example of confusing a description for an explanation. To truly understand why these traits exist, you have to look at the individual's life experiences, particularly their early developmental history, and how those experiences acted on their unique genetic predispositions to shape their brain. The diagnosis helps us name a pattern. Sure, that can be useful.
Yeah.
But the true explanation lies in the individual's unique life story and how their brain adapted to it. Understanding that distinction, that difference between description and explanation, helps you understand the crucial role environment plays and how these challenges actually came to be. And that opens the door to meaningful interventions that go way beyond just managing symptoms.
Okay, the connection between ADHD and addiction is often discussed, and your insights here feel incredibly powerful. It seems like many people diagnosed with ADHD also end up struggling with addictive behaviors. What's the link there? And how do these early childhood conditions play such a profound role in this kind of dual challenge?
Yeah, there's an incredibly strong link. It's undeniable, really. During my 12 years working in Vancouver's downtown east side, which is sadly North America's most concentrated area of drug use, A really significant percentage of my patients presented with what was clearly undiagnosed ADHD.
Wow.
The commonalities are just striking. First off, both individuals with ADHD and those grappling with addictions often share that difficulty in self-regulation, that core challenge with impulse control.
Hmm.
As someone once profoundly said about addiction, the problem isn't a lack of free will, it's a lack of a free won't.
Lack of a free won't. That's
Yeah.
a vivid way to put it. Deeply insightful. It shifts the whole perception, doesn't it? From like moral failing to maybe a biological reality shaped by experience.
It does. And secondly, all addictions, it doesn't matter what the substance is, or even if it's a behavior, they fundamentally involve the dopamine system in the brain.
Right? Dopamine again.
Exactly. This is the very same system we were just discussing as being affected in ADHD. Think about stimulant addictions, crystal meth, cocaine, nicotine, even caffeine. They directly boost dopamine levels. They provide that temporary surge of energy or focus or pleasure.
Okay.
So it's really no coincidence then that a significant percentage, conservatively, I'd say 30% or more of stimulant addicts, are also diagnosable with ADHD. Their brains, already impacted by early life conditions, are almost instinctively seeking to self-regulate that dopamine system.
Just through external means.
Exactly, through external means that ultimately cause harm.
So it's not just about substance use then, because you define addiction much more broadly than how most people typically understand it. What is the true nature of addiction, in your view, beyond just the conventional focus on drugs and alcohol?
Yeah, I define addiction very inclusively. I see it as any behavior in which a person finds temporary relief or pleasure, right? So they therefore crave it. But then they suffer negative consequences as a result of that behavior, and critically, they are unable to give it up despite the harm it's causing.
Okay, that's a broad definition.
It is. And by that definition, I'd argue that most people have experienced an addictive pattern at some point in their lives, whether it's to substances like alcohol or nicotine, or maybe to behaviors like excessive screen time or overworking or shopping.
So most people,
Yeah.
it's not just, a specific group of individuals struggling with severe substance abuse. It's actually maybe a universal human experience, perhaps just to varying degrees, rooted in how our brains seek relief.
Absolutely. That's how I see it. And the crucial shift in perspective, the really helpful one, is to stop asking what's wrong with the addiction and instead start asking what does it give the person in the short term? What unmet need is it attempting to fulfill?
Right.
So, for example, for someone who turns to alcohol, maybe it offers a fleeting sense of belonging at a social gathering. Or maybe it's just a way to turn the brain off for a bit, escape from overwhelming thoughts or a deep feeling of inadequacy. If we can understand that, then we can ask the next question. When do people need to escape? Well, usually when they're feeling chronically stressed, when they're suffering from emotional pain, when they're isolated, or when they feel fundamentally unsafe just being in their own skin.
Yeah.
My core philosophy for understanding addiction is really encapsulated in this simple but, I think, profound question. Don't ask why the addiction, ask why the pain.
Ask why the pain.
Yeah, and if you want to understand the pain, you absolutely must look compassionately at the person's life experiences, particularly their early development, not just their genes, not just their moral character. You have to understand the life.
That's a really profound reframe. It transforms addiction from seeming like a moral failing or just a lack of willpower into, well, a desperate, albeit ultimately harmful, coping mechanism for much deeper wounds.
Exactly. And this applies just as much to that wide range of behavioral addictions that are becoming increasingly prevalent in our modern society, right?
Like what?
Shopping, gambling, pornography, social media, excessive gaming, even work itself. All of these can become addictive because they provide those quick dopamine hits, that temporary escape, or maybe a sense of control that's missing elsewhere. Brain scans on individuals struggling with, say, pornography addiction, they show dopamine spikes that are remarkably similar, both in intensity and pattern, to those experienced by people addicted to drugs. The fundamental drive is the same, seeking temporary relief or pleasure to cope with some underlying discomfort, anxiety, or emotional pain. And that pain often stems from those early life experiences where fundamental needs for safety, for connection, for authenticity simply went unmet.
You also talk about the brain's internal opiate system, the endorphins, and how that connects to addiction, especially something like opioid addiction. That's a fascinating link. Tell us more about that.
Yeah, our brains are remarkably equipped, aren't they? We have this intricate system of internal opiate receptors, and they produce what we call endorphins, which is just a contraction of endogenous morphines, our body's
Right.
natural
High
morphine.
runners, high stuff.
Exactly. They're our body's natural painkillers and pleasure chemicals, and they are crucial for several really vital functions. First, as you said, pain relief. They provide powerful pain relief, both physical and emotional pain. It turns out the same brain regions process both types of pain.
Oh, interesting.
Yeah, and our internal opiates work right there to soothe that discomfort. Second, along with dopamine, they give us that profound sense of pleasure, elation, joy. This is absolutely essential for navigating life's difficulties, isn't it? We need the expectation and the experience of good, joyful experiences to balance out the inevitable challenges. And third, and this is critically important for human development and survival, endorphins facilitate love and attachment. They help us feel deeply connected to other people. They play a fundamental role in parent-child bonding, which is absolutely vital for a child's early survival and their secure development.
Hmm.
Without these bonding chemicals, a child simply cannot thrive. Even in animal studies, if you block a baby animal's opiate receptors, they won't even cry out for their mother when they're separated. In the wild, that would mean certain death.
Wow. So our bodies naturally produce these kinds of warm, soft hugs internally. And for some people, the external opiate, like heroin or painkillers, becomes a substitute when that natural system is maybe underdeveloped or overwhelmed by pain.
Precisely. So individuals who develop opiate addictions, whether it's to prescribed painkillers initially or illicit drugs like heroin, often come from lives that have profoundly undermined their natural opiate circuitry, usually due to early pain, adverse conditions, or maybe a lack of consistent loving connection. The external opiate then becomes this powerful, immediate, albeit ultimately devastating substitute for the comfort, the connection, the pain relief that their own internal system just couldn't adequately provide. I vividly remember a patient I worked with, a sex trade worker, who told me the very first time she used heroin, it felt like a warm, soft hug.
Wow.
That simple phrase just captures the powerful, desperate draw, doesn't it? It fulfills a deep, unmet need for comfort, connection, soothing something that was likely profoundly absent in her early life. Addiction, when you see it in this light, becomes a complex response to the environment and its deep impact on brain circuitry. It's not merely an inherited disease, despite what common medical belief often suggests.
There is so much shame, isn't there? And self-blame associated with addiction and often with ADHD too.
Yeah.
This understanding that these are actually adaptations to pain, it truly empowers people to see themselves differently, doesn't it?
That's the whole point, really. And that's why this perspective can be so transformative for people. Understanding the intricate brain circuitry and its deep connection to early childhood conditions, it helps individuals separate themselves from the condition. It's not a personal failing. It's not a character defect. It's not some disease they were simply born with and are just destined to live with forever. It's more like a circuitry and conditioning problem.
Okay.
And that framing allows for a profound sense of detachment, objectivity. It helps move away from blame and shame and guilt. And while we are absolutely not to blame for the initial cause of these adaptations, I mean, we didn't choose our childhood circumstances.
Right.
We are empowered to take responsibility for addressing it now, for embarking on our own healing journey.
So it becomes less about it's my fault and much more about it's my responsibility now to heal.
Exactly. And the evidence supporting this environmental link, it's just overwhelming when you look for it. Think about classic studies like those on Vietnam veterans. Many used opioids heavily while they were in combat under extreme stress.
Yeah, I remember hearing about that.
But then, often, they just ceased their addiction upon returning to more supportive, stable home environments. It wasn't universal, but it was common. Similarly, you look at laboratory rats. Rats consistently exposed to adverse environmental conditions, isolation, stress readily become addicted to opioids. But rats kept in supportive, stimulating environments, they're almost impossible to addict regardless of how much exposure they have to the addictive substances.
Wow, that's stark.
It powerfully illustrates that the environment strongly predisposes or protects against addiction. And healing, in this context, it's often not just an individual process. It is fundamentally a social process. Social support, like the kind found in 12-step groups, which are incredibly valuable for their acceptance and shared experience. Let me be clear. That support is crucial for addressing these issues in a compassionate, non-shaming environment. Although I do personally believe what's often missing from even these valuable groups is sometimes a deeper awareness of the profound role that trauma and early life experiences play in actually shaping the addictive patterns in the first place.
Okay, we've explored how ADHD can be seen as an adaptation to early stress, and how addiction often serves as a coping mechanism for deeper pain, both deeply rooted in environmental impacts on our brain chemistry. Now, let's shift gears a bit to something that's becoming a really alarming crisis and often feels purely physical, maybe completely disconnected from our emotional life: autoimmune disorders. These conditions, where the body literally attacks itself, they seem to be on a dramatic rise and particularly impact women. What's going on here?
Yeah, autoimmune diseases are indeed on an alarming global rise. It's a category of conditions where the immune system, which, is designed to protect the body from external threats like bacteria and viruses, instead mistakenly attacks the body's own healthy tissues and organs. Examples include things like multiple sclerosis, rheumatoid arthritis, lupus, fibromyalgia, chronic fatigue syndrome, Crohn's disease, psoriasis. There are well over 100 conditions now identified.
Oh.
And here's that striking statistic you mentioned, which is often overlooked. Approximately 80% of autoimmune disease sufferers are women.
80%?
Yeah.
That's just incredible. Such a disparity.
It is, and that disproportionate impact, it immediately points towards something deeper, right? A societal, maybe a cultural factor at play that goes beyond just random genetic predispositions.
So what common characteristics or maybe life patterns do you observe in your patients who suffer from these conditions, especially the women? Is there some kind of shared thread in their lived experience?
Well, in my medical practice, over decades, really, I began to notice this consistent pattern. 4 key traits seem to emerge among people, predominantly women, who developed autoimmune diseases. First, they have this deeply ingrained tendency to consistently put other people's emotional needs ahead of their own, often to the point of completely ignoring or suppressing their own needs, their own boundaries. They habitually prioritize making others comfortable or happy, or just avoiding conflict, often at great personal cost to themselves.
So a real deep-seated people-pleasing tendency, maybe driven by a need for external validation or acceptance.
Precisely. Second, they tend to identify very strongly with roles, duties, rules, and responsibilities rather than with their authentic self, their personal needs. Their whole sense of self-worth becomes profoundly tied to fulfilling obligations to others. Being the good daughter, the perfect employee, the selfless mother.
Right. The identity is based on the doing for others.
Exactly. Third, they typically present as very nice individuals, which often means, when you dig a bit deeper, that they repress healthy anger.
Healthy anger. Is anger healthy?
Absolutely. Healthy anger, in its essence, is a crucial boundary defense. It's how we say no to what is harmful. It's how we protect our personal space, how we assert our needs. When you're just nice all the time, you tend to internalize that necessary aggression, often turning it against yourself.
Okay.
And fourth, they often believe they are personally responsible for how other people feel. They strive never to disappoint anyone. They carry the emotional burdens of others as if they were their own.
Wow. That sounds like an absolutely immense amount of emotional labor, constantly trying to manage everyone else's emotions and expectations while completely neglecting your own. The internal stress from that must be just tremendous.
It truly is. And these deeply ingrained beliefs and behaviors, they lead to this constant stream of yeses to external demands, taking on undue stress, other people's burdens, never truly resting or advocating for themselves. And this chronic stress, whether it's conscious or unconscious, relentlessly undermines the immune system. When the body is in that perpetual state of perceived threat or emotional siege, its resources get diverted. And the immune system, instead of protecting, can begin to misfire. It can turn against the body itself. It's really a physiological response to a deep and prolonged psychological state.
How does that actually happen physiologically, though?
Yeah.
How can repressed emotions truly affect the immune system to that degree? This sounds like, well, the cutting edge of science connecting mind and body so directly.
It is, and the scientific field that studies this exact connection is called psychoneuroimmunology, PNI.
Psychoneuroimmunology, okay.
And it unequivocally demonstrates that the immune system, the hormonal apparatus, our endocrine system, the nervous system, and our emotional system are not separate entities. They are, in fact, one single integrated, interconnected system.
Wow, one system.
One system. They are extensively wired together, chemically and neurologically. Their communication communicating constantly. So when you consciously or unconsciously repress healthy anger, for example, you are literally biologically suppressing aspects of your immune system function.
So it's not just a metaphor like, oh, being angry makes you sick. It's
No.
a literal biological suppression of immune function happening.
Yes, it's a direct biological mechanism. Think about it this way. Healthy anger serves as a vital psychological boundary defense, right?
Hmm.
It helps you assert yourself, say no to what's harmful or overwhelming, protect your personal integrity. In parallel, the immune system serves as your physical boundary defense. It's meant to let in what is nourishing and keep out what is toxic or harmful.
Okay, I see the parallel.
So when you consistently suppress your authentic emotions, especially healthy anger or maybe profound sadness, you interfere with this inherent boundary system. It's almost as if you're training your immune system not to protect you effectively from perceived threats, whether they're internal or external. And often, repressed anger can turn against oneself, can't it? In the form of depression or self-loathing or even self-destructive behaviors. Similarly, chronic negative thoughts, like constantly blaming yourself for childhood circumstances that were absolutely not your responsibility, can manifest as negative self-talk aimed against yourself.
Yeah.
The immune system, running in parallel, can then turn against the body it's supposed to defend.
That makes so much sense when you put it like that.
Yeah.
So to come back to that striking statistic, why women? Why are they so disproportionately affected by this? Does it circle back to that deeply ingrained societal conditioning?
Absolutely. It links directly to societal conditioning and also to those fundamental childhood needs we talked about earlier. In our dominant culture, let's face it, women are disproportionately programmed, often from a very young age, to be the caregivers, to prioritize others' needs, to uphold duties and roles, to always be nice, to avoid expressing healthy anger, and to take responsibility for other people's feelings and emotional comfort.
Yeah, the good girl conditioning.
Exactly. And this pervasive cultural programming, when it's combined with other stressors like maybe minority status or demanding high-stress professions like first responders, it significantly increases the risk of autoimmune disease. For instance, there are studies in Canada showing Indigenous women have 6 times the rate of rheumatoid arthritis compared to others. That tragically reflects historical trauma and ongoing societal stress that just compounds these learned emotional patterns.
So it's a cultural burden then, not purely some gender-specific biological weakness. And this ties into that crucial conflict you discussed before, the conflict between attachment and authenticity. That seems to be at the heart of so many of these challenges.
It really is. Every child, every human being has 2 core non-negotiable needs that are just vital for healthy development, for survival. First, that deep primal need for attachment, the need for belonging, for unconditional acceptance, for being held and supported, feeling safe in the world. Without that, an infant literally cannot survive.
Right.
Second, there is the equally profound need for authenticity. The need to be connected to one's genuine emotions, one's innate impulses, what we often call our gut feelings. We evolved with these gut feelings for survival, didn't we? They are our internal compass. I mean, how long does any creature out in nature survive if they don't pay attention to their instincts, their gut feelings?
Not very long at all. Their survival depends on it.
Precisely. Now, here's the tragic choice that many children are implicitly or sometimes explicitly forced to make. If a child receives the message from parents, caregivers, the environment that expressing their authentic emotions, their true impulses, their natural anger makes them unacceptable, that their parents will withdraw love or attention or approval if they show those feelings, well, they're faced with an impossible dilemma. They are compelled, for survival, to give up authenticity for the sake of attachment.
Wow. Give up authenticity for attachment.
Yeah. They learn to distrust their own instincts, to suppress their feelings, to bury their true self, because their very safety, their very survival in that moment depends on being acceptable and loved by the attachment figures. This isn't a conscious choice, remember. It's a deep survival-based adaptation.
And this choice, made unconsciously in childhood just to secure safety and love, tragically continues into adulthood, often without us even being aware of it.
Yes, often completely unconsciously becomes an ingrained pattern. Individuals and overwhelmingly women, given the cultural context we've discussed, continue to prioritize being acceptable, securing external attachment over being true to themselves, expressing their authenticity. They ignore their gut feelings. They say yes when every fiber of their being screams no. They suppress their anger or sadness to maintain external harmony or avoid perceived rejection. And this constant self-abandonment, this chronic denial of one's authentic self, it creates immense internal stress. The body, being that integrated system, eventually manifests this profound stress as illness. As I often say to my patients, and it's a difficult truth to hear sometimes, you've abandoned yourself, and now your body function is abandoning you.
That's a powerful and frankly heartbreaking connection. It reframes chronic illness almost as a profound message from the body about unaddressed internal conflict. The good news, you say, the hope here, is that this can be changed, that we can reclaim our authenticity and actually impact the course of these illnesses.
Absolutely. That's the empowering message here. The good news is that changing these deeply ingrained patterns, learning to say no when you mean no, learning to prioritize your own needs sometimes, learning to express healthy emotions appropriately, reconnecting with your authentic self can significantly impact the course of the illness.
Really? Even with something like MS or rheumatoid arthritis?
Yes. I've seen countless anecdotal reports, both from my own practice and hearing stories from others in the field, of people with conditions like multiple sclerosis finding significant relief, sometimes even going into remission, simply by learning to set firm boundaries,
Yeah.
learning to say no to what doesn't serve them, and learning to express their authentic feeling.
Oh.
It's like it empowers the immune system to reclaim its proper function as a protector, rather than remaining confused and acting as an attacker. It's deeply ironic, isn't it, that autoimmune flare-ups are well known to occur during periods of intense stress.
Hmm.
And yet they're often treated with steroids, which are, in essence, cortisol, a stress hormone. Doctors recognize the impact of acute stress, but maybe too often fail to fully acknowledge the pervasive chronic emotional stress that underlies these conditions, especially when a person is trapped in that pattern of always being nice, always agreeable, always taking on others' burdens, and thus constantly betraying their own fundamental needs. Hashtag the path to healing and empowerment.
This entire conversation, it feels incredibly empowering because our brain biology and even our physical health were shaped by our early environmental conditions. Well, then the phenomenal capacity of our brain for lifelong change that neuroplasticity we talked about means we have immense agency, right?
Yeah.
We can actively influence and address these conditions.
What is the most crucial takeaway, I think? If your brain biology was shaped by your life experiences and the adaptations you made, it can also be reshaped by new experiences, by conscious choices, by intentional practice. That's the profound promise of neuroplasticity.
Wow.
The brain isn't just some static organ that's fixed after childhood.
Right.
It's constantly rewiring itself based on experience, learning, interaction. So even if patterns were set way back in childhood, new intentional experiences and conscious work can literally create new neural pathways. They can allow for different responses, healthier functioning. So for parents of children with ADHD, for instance, medication, if it's used, should always be considered just a short-term tool, never the sole option. The primary focus really should be on creating a better, more understanding, more emotionally attuned atmosphere in the family, fostering genuine connection with the child rather than just trying to control their behavior with a pill.
Yeah.
No child should ever feel like they're only acceptable when they're sedated, right? We want to promote their healthy, authentic brain development, not suppress it.
And for individuals who are struggling with addiction, how does this understanding translate into a path forward for them?
Well, for individuals struggling with addiction, it's absolutely vital, I believe, to internalize that there is nothing fundamentally wrong with them as a person. Addiction, seen from this perspective, is a perfectly normal, understandable response to abnormal circumstances, often stemming from that early life, pain, adverse experiences, or trauma. Healing is profoundly possible. First, through understanding this connection, realizing it's not a moral failing, but a circuitry and conditioning problem. And second, by engaging in compassionate social support. It's about rebuilding connection, both with oneself and with others, in a safe, non-shaming environment.
So beyond just understanding the why, what are some concrete, practical steps someone listening could take to begin this path of healing and change? Where does one even start? It can feel overwhelming.
Yeah, it can. I generally recommend a sort of two-pronged approach that helps you begin to untangle these ingrained patterns. First, instead of focusing solely on stopping the addictive or problematic behavior, whether that's, doom scrolling for hours or reaching for that extra drink or compulsively overworking, you need to pause and identify the underlying need that this behavior is actually serving in your life.
The need behind the behavior.
Exactly. Ask yourself truly, What essential need is this behavior meeting for me, at least in the short term? For example, is that doom scrolling an escape from an uncomfortable emotion? Or maybe just from being with yourself? Does drinking temporarily fill some void of joy or play or relaxation in your life? Do you feel discomfort just being yourself? Or feel a constant need to do rather than simply be?
Mm-hmm.
These needs themselves are valid. They often stem from those early childhood experiences of maybe not feeling seen or accepted or good enough just as you were. The goal then becomes to identify that legitimate need and learn to meet it in healthier, more self-supporting ways, rather than through behaviors that cause long-term harm.
So it's shifting from fighting the symptom to actually compassionately addressing the root cause, that unmet need. That's a crucial reframe for so many people, I imagine.
It really is. And the second practical tool I often suggest is a powerful self-inquiry exercise. I call it the 6 questions to freedom. You can do this as a journaling exercise or just reflect on it regularly.
Okay, 6 questions of freedom. I'm ready.
Yeah.
What's the first question?
Way. Question 1. Where in your life do you have difficulty saying no? Just notice. Think about this across all areas of your professional life. Personal relationships, family dynamics, maybe even internal demands you place on yourself. Where does that no get stuck in your throat?
Okay. I imagine many listeners, myself included, immediately think of areas like work or maybe certain personal relationships when they hear that question. It surfaces pretty quickly for most people.
Yes, it often does. So then question 2. What's the impact on you of your difficulty saying no? How does it actually manifest? How does it make you feel? Or what are the consequences in your life? Think about things like exhaustion, feelings of shame, cycles of self-blame, maybe suppressed anger that builds up, a pervasive sense of losing control over your own life, or even frequent physical illness like colds or burnout. And that feeling of loss of control, by the way, that's a significant stress trigger for many people. It's often rooted in a learned childhood need for safety that came through external control or compliance.
Yeah, that one hits hard for me, and I suspect for many listeners. That exhaustion, and certainly that feeling of losing control over one's own time, one's own life, it can feel overwhelming.
It absolutely can be. Then we move to question 3. What's your core belief that keeps you from saying no? What's the underlying story you tell yourself, often unconsciously, that dictates this behavior? Is it something like, if I say no, I'll be rejected, or I'll get fired, or they won't like me anymore, or maybe I'm responsible for everyone's happiness, or even the weight of the world is on my shoulders and only I can handle it? This question starts to reveal that deep foundational programming.
And it's interesting how quickly those core beliefs can surface for people. Those fears of rejection or that sense of being responsible for everyone else's happiness. Those seem like really common themes.
They absolutely are. Which leads us directly to question 4. How did you develop that story? Where did it come from? This question connects right back to your early childhood programming. These beliefs are often learned in those deeply impressionable, almost hypnotic states as a young child, when your sense of safety, your sense of love and attachment was directly dependent on making others okay, on being acceptable, on complying. It was fundamentally a survival strategy back then.
Ah. So that's really when that authenticity versus attachment conflict truly begins to solidify within us. We learn to trade one for the other.
Precisely. You learned unconsciously to suppress your authentic self, your true impulses, your genuine needs in order to secure that vital attachment. And then the really transformative question, question 5. Who would you be if you didn't believe that story?
Who would you be?
The answer, almost universally when people really sit with that, is free. This question shines a bright light on the fundamental choice you now have as an adult, armed with consciousness. The choice of authenticity over the unconscious compulsive pursuit of external attachment or validation. You have the agency now to reclaim your freedom.
Free.
Yes.
Yeah, that's incredibly powerful. And you mentioned 6 questions. What's the 6th one?
Yes, and this one is often overlooked, but I think it's incredibly crucial. Question 6. What are you not saying yes to in your own life?
What are you not saying yes to?
Yeah. This reveals what you're truly missing out on, what you're depriving yourself of by constantly saying yes to external demands, to duties, to the needs of others. Are you not saying yes to your own free time, to play, to joy, to creativity, to rest, to your own spiritual nourishment, to simply being kind to yourself? Not saying yes to these vital self-supporting needs is ultimately just as harmful to your well-being as not saying no to those external demands. It's about finding that essential balance, honoring your whole self, not just the parts that serve others.
Wow, that final question. That one is incredibly impactful, I imagine, for many listeners. To realize what they might be starving themselves of, by constantly giving everything away to others. Play, rest, just being. That's a huge insight.
This whole exercise, it just helps you shine a light on these ingrained patterns, these unconscious contracts you've made. And then you can begin to make conscious choices to reclaim your agency. And the beautiful, hopeful truth in all of this is that healing is possible. It's possible for everyone, regardless of their financial resources or social standing.
That's a really important message to end on, because often it can feel like these kinds of profound conversations about healing are only truly accessible to those with significant financial means. People who can afford years of therapy.
Not at all. I truly believe that there are so many free resources available if you know where to look and if you're willing to commit to the inner work. My talks and those of many other wonderful teachers who share similar perspectives, they're widely available on YouTube, and they've profoundly impacted people's lives without costing a penny. You can take relevant books out of the library, delve into self-study. You can learn to meditate, learn just to be with yourself, observe your mind, gently process emotions. There's abundant, high-quality, free meditation instruction online now that helps regulate the nervous system. Connecting with nature, even just a local park, a quiet walk in the woods, has profound healing capacity. Our indigenous peoples and ancient wisdom traditions, they deeply understand this innate connection to the calming, restorative power of the natural world.
Yeah.
And then there are the basics of self-care that are within most people's reach. Consistent exercise, making conscious, compassionate choices about proper food within your means. Of course, for those who can afford it and find the right kind of practitioner, therapy, especially with a trauma-informed approach, can be incredibly helpful for guided processing.
So it's ultimately about making that conscious decision, accepting responsibility for your own path, and then taking small, consistent steps, recognizing the universality of these experiences maybe.
Exactly. As long as there is consciousness, there is the capacity to heal. I truly believe that. This truth is affirmed even in the final moments of life. Consider those top regrets of the dying, often observed by palliative care nurses who spend their lives at the bedside.
What are they?
Things like not having the courage to live a life true to oneself rather than the life others expected. Not expressing emotions more freely, wishing they hadn't worked quite so hard, and wishing they had allowed themselves to play more, to experience more joy.
Wow, that's sobering.
It serves as a powerful motivator, doesn't it? To reclaim our authenticity and our capacity for joy now, while we have the time and hopefully the health. Healing fundamentally requires the decision to embark on that path, and the courage to meet yourself with compassion exactly where you are. #outro.
Wow, what an incredible deep dive into these really profound connections between our earliest experiences, our childhood adaptations, and how they can manifest in our adult health. We've seen how diagnoses are often, insightful descriptions, but rarely the full explanation. And how our bodies really do reflect the silent stories, the suppressed needs we carry, often from childhood. And this isn't about assigning blame for what happened back then. It's really about empowerment.
Yeah.
Recognizing that while we may not be responsible for the initial circumstances that shaped us, we are responsible for our healing journey now, for consciously choosing a new path forward.
Understanding these intricate links, from seeing ADHD perhaps as a brilliant adaptation to early stress, to understanding addiction as a desperate search for relief from emotional pain, and seeing autoimmune diseases possibly as the profound cost of suppressed authenticity, it truly frees us from shame, doesn't it? And it opens the door to genuine, sustainable healing.
Yeah.
It reminds us that our brains are just remarkably adaptable, our bodies are these interconnected systems of mind and emotion, and our capacity for growth and change is truly lifelong.
So what does this all mean for you listening right now as you reflect on this conversation? Maybe consider, where in your own life might you be unconsciously prioritizing that need for attachment over your need for authenticity? Or perhaps saying no to your own essential needs by constantly saying yes to everyone and everything else? What small, perhaps courageous step could you take this week? Just one small step to begin trusting your authentic self a little more and reclaiming that profound freedom we talked about. Maybe it's saying a gentle but firm no to a new demand on your time. Or maybe it's making space for a deliberate, joyful yes to a moment of rest or play or creative expression that your soul deeply craves. Remember, the capacity to heal, to reclaim your authentic self, it truly is within you, waiting to be unleashed.